Hi there, it's Roxanne Gould, ANAC Lobbyist, and Dr. Huskova, Executive Director for ANAC.
Thank you.
Wanted to give you a quick update on AB 5, the Independent Contractor Bill. In our previous update, we had mentioned that the bill had become law. It has potential and true negative impacts on so many industries, including healthcare. But I wanted to let you know that we are partnering with a very large healthcare coalition that is trying to specifically call out the flaws that AB 5 and the impact that AB 5 has on the healthcare industry, particularly nursing. You know, nurses that may contract with multiple hospitals will no longer be allowed to do that and will have to become an employee for a particular hospital.
Well, since the bill became a law January 1st, and nobody really knows how it's going to be, so, people already now have to abide by the new law. So I think that many, especially, some of our coalition partners and some of our members, such as nurse practitioner and nurse midwives and some clinical nurse specialists and definitely nurse anesthetists, they are really struggling with this new law because especially right in rural areas when they have contract with multiple hospitals, that becomes unsustainable because the law doesn't allow it anymore. So I think many of our APRN partners and also the nurses dealing with postpartum visitation, lactation specialists, there are a lot of nursing specialties and nursing aspects that are being negatively affected by this. And so Roxanne just mentioned that some of the bills trying to fix this, that they have a category of healthcare, but so far what we've read, it's not nursing specific, it's healthcare, because I know that we talked about it even last year, that physical therapists, respiratory therapists, nutrition therapists, registered dietitians, right, all these people kind of belong into the same thing, and many of them were independent contractors and just giving their expertise. The same, let's say, that for professional nursing organizations who are offering education courses for CEUs, we need to go outside of our staff and to have a contract with a nurse expert and expert content, right? So we cannot do that anymore. And even we cannot, Roxanne is our lobbyist because because they are lobbyists, and I think accountants, they are exempted, but it really changes the way how we, even at ANAC, how we can do business. And so, Roxanne, did you mention how many bills are there that are trying to fix this?
I don't even remember the exact number. It's more than 25.
Yeah.
They're all very generic at this stage, or for the most part generic. It's really, they're place savers because of the bill introduction deadline to say, we want to fix this part of AB 5. The author is reticent to really do much in terms of significant amendments, but we're hoping we can put pressure on from the governor's office, speaker's office, pro tem's office. In fact, we belong to a very large coalition of healthcare professionals that are specifically trying to call out the flaws in the healthcare arena, us, of course, specifically in the nursing space. We met with the speaker's staff who commented that the entire caucus, when they meet, they're hearing from constituents, and if you are concerned about AB 5, please do reach out to your assembly member or senator. They need to hear that it has real problems and needs real solutions. They basically said they understand, their members get it, but they need real life examples in order to put any pressure on the assembly member to fix the aspects of healthcare and nursing that are so negatively impacted.
And many of you who are actually dealing with the effects of that, you have everyday examples. You have them. So just describe them, right? Look up your legislator on Google, who is my legislator in California. You will have assembly person and Senate. You just need to include your residential address and the information show up there. If you don't want to talk to them, email them, post on their Facebook. They live on Twitter. Just use any platform you like, but please share how it is affecting you and therefore how you are unable or limited in providing care to patients, and therefore the community is losing access to care, and that's really important.
And they want to hear from you. And it isn't vital that you actually speak with your particular legislator, senator, or assembly member. It is crucial that you talk to their representative. They need to hear from you. They have to vote on everything from carpet to paint to agriculture to air quality to nursing. They 2,500 bills from last year, 2,200 from this year. They need to hear from specialists like you on what the impact of a particular bill is.
Perfect. So whatever is happening next, we'll update you, and we'll keep updating you on this very important issue. Thank you so much.
Thanks for being a member.